I next have the distinct privilege and pleasure to introduce a woman I've introduced before, in fact, introduced to this organization as a genuine star in our heavens at FARA. She really is that. She's not only a model of what patients can accomplish for all of our stakeholders, she's a real leader in inspiring other patients to do the same. She not only serves as one of FARA's ambassadors, and we have about 55 of them now that serve in all kinds of capacities to help you in advancing your therapeutic candidates, but she serves in the leadership group of all those ambassadors, and she also helps inspire and train them. She actually, near her own home, does what she calls an adventure day, at which she gathers patients and patient ambassadors, patient advocates, and does team building activities, does confidence building activities, shows the patients that they're far more capable than they think they might be, and teaches them how to work together as a team. So she does all that, and she's even at some of her adventure days included ARM members. One recently, she had Voyager Therapeutics come and participate in all those team building activities with our patients, and showed the patients how we're working with our pharma partners, and showing our pharma partners how important it is to work with our patients. She's earned her master's degree in social work and is a licensed social worker. And she still makes the time to be one of our most active participants in all kinds of research, from basic to clinical. And so it's my distinct pleasure and privilege to introduce Jean Walsh.
I just wanted to tell my story and then make a few points. So I'll start with my story. This is me when I was about 1 year old. The mores about playing with toys that are smoking were a little bit different in the 60s. But that's me, and my 1-year-old self could walk, and my 33-year-old self couldn't walk anymore. This is me at about 13, just one of the millions of girls that love ponies. I really love ponies, and I was lucky to have one. I thought, and I really wished I would be an Olympic equestrian, but FA had different ideas for me. This is me when I about 16, when I started becoming symptomatic. My first memory of things being weird was when how lucky am I, I'm sorry, to have this sweet face looking at me. My first memory of being symptomatic was when I was doing this stuff, this equestrian stuff. You have to walk the course before the competition with your coach, and they tell you all what to do. Well, I kept getting in trouble because I was looking down at my feet the whole time instead of looking up at what I was supposed to do. Other memories are that every time I hit a batch of ice, I would fall down. My friends started to wear high heels. I could not wear high heels without twisting an ankle or falling off them somehow. I guess my family just felt like, and I just felt like I was getting klutzy. I mean, I guess that doesn't really happen. You're klutzy or you're not klutzy, but that's what we thought was happening. Yeah, I need to advance these. This is me about 19 when I got diagnosed. I think for us, my family were fortunate in that it only took about 2 years to get diagnosed, and then we spent another couple getting the FA diagnosis confirmed, because who wants to hear that? But, so my 19-year-old self heard, you have Friedreich's ataxia, there is no cure, there is no treatment, you're probably gonna use a wheelchair in your mid-20s, you're probably gonna be dead by the age of 35. Then, this doctor had me leave the room and told my parents that I would become probably a substance abuser. So I knew my life was going to be short. My parents thought my life was going to be short and miserable. So that's what I was told at that time. Fortunately, my parents were just like, whatever that guy just said, we're not taking it. You live according to what's happening to you right now. And if those things happen, we'll cross that bridge. But, so 55, not dead. But yeah, that was a tough time for our family. I forget. Okay, this is at my wedding. My younger sister on my right, so you guys have left. She was diagnosed in 1991. I feel like she was symptomatic, but no one wanted to deal with it because at that time it was no cure, no treatment, take some vitamin E, this might be helpful. we didn't even get, like, maybe you should work out. That might be a good idea. We didn't get that. We got nothing. We didn't get physical therapy. We didn't get occupational therapy. We didn't get a social worker. We didn't get any help with being diagnosed. So, more rough times for my family. But life goes on, right? My sister, who is the middle sister, is not even a carrier of FA. She had 3 boys, and my sister with FA, she had. Those are her kids, but they're back in the day. The boys are all graduated or in college, and Trisha's kids are high school, college. So, life goes on. You live with a rare disease or not. So, I just want to make the point that, as you heard in my diagnosis, the doctors, when I was diagnosed, they told me I might get an enlarged heart. They told me I might have severe slurring in my speech. They told me I'm probably going to have scoliosis, which I do. But they told me all these bad things were gonna happen, but they weren't happening to me. I didn't have diabetes, I didn't have heart disease, I still don't. And my neurologist, who's awesome, assures me that I probably will never have those things. So, I'm lucky, but I didn't get it. Like, intellectually, I got it. But in my heart, I did not get it. Then I met someone who's had all those things, and I was like, I gotta do something. That was really my call to action. So the point I want to make with that is that if someone with the disease doesn't get how bad the disease can be, how can someone who's never met someone with the disease? So it's important. And so one of the things I do to do something is do I call them FA Adventure Days. I used to work at a place called Project Adventure, so I know a bunch of people in the field, in the adventure field, education field. And, sorry, I don't know why I'm doing this now. So that is a super fun time that we just spend a day, we get to know each other, we get to build community, we get to do things that we thought we couldn't. But I'll tell you this, and this is important to remember. My friends who volunteer to facilitate these days they are so impressed with us every year because they say we're the best at working together as a team, and I'm sure we're not the only patient group that does that. So yeah. So that's my friend Matt. That's us doing a problem-solving activity. Before and after. Yeah. Another team building, problem solving activity. And whoever says someone in a wheelchair couldn't do a trust fall is wrong. And so that's me at Voyager Therapeutics. So basically, since I met my friend that's so severely affected with FA, I try and do whatever I can. Participate in clinical trials, talk to pharmaceuticals, talk at fundraisers, give my own fundraisers, all that kind of stuff. And I'm also part of the Ferret Ambassador Program, which we do a lot of really cool things. I think I have it on the next slide. Oh. This is just me. This is just to keep in mind that although these diseases are so tyrannical, and you suffer loss after loss after loss, you still live life. You still go hang gliding. You still go to India. Life goes on, right? You still love your life. So patients are not just, I mean, I think I'm speaking to the choir, but patients are not just a disease. We're not just recipients of your brilliance. We want to be collaborators with your brilliance. Thank you. So my sister and her family are great too. This is a more recent picture. I don't know why her son is not showing his hands. His handsome face, but they're doing good. And this is the thing I was just saying, I'm super stoked about this thing lately. We call them F-18 hangouts. So they're for teenagers with ataxia of any form, but so far it's just been Friedreich's ataxia. And they just come once a month and we meet on WebEx and they just hang out and they get to be teenagers hard enough. It's super hard when you have FA and you don't know anyone else who does. So they get to hang out, the talk. Yeah, I really love it. And I wish I'd had something like that when I was 19. And we just started having the kids lead them. So the kids pick the theme and they lead the group and everything. It's nice. We coach them.